Myself, Dr. Tapas Kumar Sahu. I am the one of the course director for 360 Critical Care, as well as for all the courses that is running under the banner of 360 Critical Care. So if anybody can take the time to introduce themselves, it would be great. And we want it to be very interactive. There is no such, we can say, training lesson in this class. Rather, it should be a both way, and we can have very vivid discussion related to different aspects of training, then how to prepare for the examination. Maybe it is EDIC 1 this time, or maybe if you are planning to appear for the EDIC 1 in the next season as well. So we can have any discussion ranging from critical care to career counseling, anything. What I can see, Dr. Priyanka, Dr. Lakshmi Narayan, Dr. Jay Lakshmi, Dr. ST, and there will be many people who will be joining very soon. Hello, Dr. Priyank. Good evening. Am I audible?
Yes, sir.
Yeah, perfect. Yeah, so perfect. There is a question in the chat box. How many attempts for EDIC part 1? So normally they say it's 3 attempts maximum. It's 3 attempts maximum, and after that it would be at the discretion of the chief examiner, like examination department of ESICM. So you can write to them, like in the case of COVID time. So if anybody has already crossed 3 times or 2 times and they didn't get time to read, so they are normally, like, you can send one email to them and they consider case to case basis and they take their decision. But for all practical purposes, it's they say it's 3 classes, 3 attempts. Yeah, sorry. So Dr. Priyanka, where are you working? You all can switch on your video. There is no problem at all. So it's very informal class where we will be discussing about your queries and how to start the preparation. Yeah, Baptist Hospital. Okay, very nice. I was the examiner for the TRNB. Yeah. And IDCCM in the Bangalore St. John's as well as Manipal Hospital 1 month before. Yeah. So maybe there was a candidate from Baptist Hospital. Yeah. Welcome. Good evening, Dr. Sananta.
Good evening, Dr. Tapas.
So just to introduce Dr. Sananta Kumar Das is my co-course director for everything what we do in 360 Critical Care. And we started this 360 Critical Care thinking that we should do something for the training and education of our own trainees, not only in India, as well as the nearby countries where still the education for the medical curriculum and specifically critical care, it's still not very robust. And we started with that vision, and after I think 1.5 years down the lane, we think we reached to maybe 10% and maybe 20%, but still a long way to go. And we had started many things for the first time. And one of the first time I would say would be started for the EDIC part 1 this season, and that is the app based training. And we are completely right now transferring our all education, the domains, the classes, the live classes, the recorded classes, the questions, the discussion, the quizzes, the analysis, everything to very handy and user friendly app. And that would be discussed by Dr. Sananta towards the end of my lecture, my this today's presentation. And hopefully everybody would be benefited by that app, because that was never used before, at least in India. Yeah, it was before in the developed countries, but not in India or nearby countries. What do you say, Dr. Sananta?
You're correct, Tapas. So, just the aim of the app is to make things easy and things accessible to the candidates. So it doesn't have to depend on specific time frame or to be present in a classroom. So they can access the study material, they can appear the exam, they can revise, they can watch the videos, they can interact with the group at any time they want to. So that's the major advantage of the app. But again, we have kept a few things still as it is for a personal touch, because whatever technology we have, it should make things easy, but it should not replace the personal touch of the education and training. We are slowly building up the app starting from the EDIC 1 and should be ready on the launch date of the exam. Basically, we'll talk about the app, how it works, and what are the facility that we have provided in it. Basically, it will be a comprehensive package of all the MCQs that is expected and the questions around each MCQs. For example, if there is a question on shock, the same question may not appear in the EDIC exam, but most of the things that can be asked around that same topic is captured in the explanation. We have a group of more than 10 enthusiastic faculties who have put their time, effort, and knowledge in making those questions and explanation. Each of the explanation will have multiple reference also. You can go and check them if you want to have a detailed discussion, detailed knowledge of that. The course enrollment will start 1st of July. Not the enrollment, the course will start 1st of July, I mean. On enrollment, the candidates will get access to study material for each domain of EDIC 1 preparation, which Tapas will go in detail. You can have the study material, you can read while on the go, like while in your duties. If you have 5 minutes, you can open the app, look at a specific article and read about it. It is readily available through your Android or through your iOS device or through your computer even. So it makes more practically feasible for you guys. Like if you have a night shift and that night shift is not going that busy, then you can just sit down in the corner for 15 minutes and revise 3 questions. That's the basic aim, so that the learning is on the go, not like sitting on your desk and in front of your computer always. You can use your what you call device time in a good way. That is the main aim for this app. Also, it gives the platform for the exam, for the practice exam. Interestingly, all the mock tests are in the app now, and you have limited time to appear the exam. You will see how you are performing, which domain of the whole subject you are weak. It will give you a breakdown of things like you are weak in respiratory system, you are weak in cardiovascular system, or you are weak in something else. That is a system you need to be more putting your time into. The other thing is also it gives you a relative position where you are in the whole group. Suppose we have 100 students in the group, it will tell you at which level you are. It's not a competition for sure. It's a collaborative learning rather than a competitive learning. So that's the motto of the whole program. Everyone helps everyone to get better in their exam so that all of you pass. But again, it does give you a inspiration or a push to be on the top. So it can tell you where you are in between. If you want to put your name will be there. You are top, or you are on the middle, or you are on the top one third or something. It can tell you how you are performing in each mock test. Like first mock test, suppose you have scored 60%, second mock test you have 62%. What is your weak point, what is your strong point? So it does give a breakdown of your preparation also. So in that way it will be very handy. um, so I will not take much time because we have already over time by 3 minutes. I will leave Dr. Tapas to start his presentation about the holistic overview of EDIC 1 exam, how one should prepare, where to go to read, what are the materials you need to study, and then I will just touch brief on the technical aspect of the course, the TRICS 1 course. All right, Dr. Tapas, please
Yeah,
take over.
I think Dr. Sanan, thank you for this uh, useful discussion, and we will be discussing everything from 0 to 100. And believe me, this class would be more of interactive, and or like we can say, we expect a lot of questions and queries. It's a lot of like hard efforts we have done for like collecting the information over the years of our training as well as our working with the SICM. I was the international Asia Pacific representative to ESICM from 2018 to 2021. So that adds little bit more value to the education as well as the examination style they normally conduct, and that comes handy in preparing the course materials. But yes, we are right on the target that this course should be useful to you all for clearing your EDIC 1. So that's the final motto. So I think without wasting further time, it's 7:05. So we should be starting it. And don't worry, we are recording everything. So if somebody is missing this class or webinar due to the prefixed appointments or the like duties or like travel or transit time right now, so don't worry. This would be available in the YouTube as well as in our official website. So welcome friends, good evening, and welcome all the faculties. I would be introducing them one by one during the this presentation at appropriate time. So this course, as we say, it's TRICS. TRICS means tricks to success, and we rightly made this as a synonym for success, or we can say targeted review of intensive care syllabus for EDIC 1. And this is a novel attempt of 360 critical care educational academy. Welcome all of you. You all have done a lot of, I would say, hard work, training in your respective postgraduate as well as critical care training time. We don't know your the educational background. Maybe it is anesthesia, maybe it is medicine, maybe it's pulmonology, or maybe it is emergency medicine or any other specialty related to the critical care. It's a team effort. That's why I have chosen the picture that we as a team of like-minded people, all hardworking, young, dynamic intensivists who have worked in different parts of the country. I would start with myself. I have done my training in India as well as abroad. And as you say, I trained in the various limitations of India as well as also in the Western culture where the training is more of very structured. But yes, the lacuna what I have faced in my training, I have tried to put it in the 360 critical care all educational academic activities. And that's why we started this novel initiative. And I would start with Dr. Sananta Kumar Das, who uh, is trained in India as well as in Australia, and he's now a consultant in Australia. He would be explaining about his own degree as well as educational qualification during his presentation. But yes, this is a joint venture of both of us, and after that, many like-minded young dynamic intensivists join hand to hand with us, and we are right now, I think faculty numbers would be more than 50. And it's not only in India, but also people from US, people from Canada, people from Australia, Singapore, Nepal, UK, you name the country and the faculties are with us. So that's the beauty of doing some good academics. Now, you all are brilliant. As I have told, you have done all the hard work. Now it's time to crack the exams. And as we are all here to discuss about EDIC 1 today, so I would not deviate from EDIC 1 because that is the target with which we have started the first introductory class, which is today. Now, the journey, I would say you are all ready to start the journey. Yes, because today is the first day, I would say, and September 26th is the exam day. If you would be knowing the date for the next season or this season, I would say it is September 26th, 2023. So now from 17th till 26th of September, 17th of June to 26th of September, we have almost 3 months, 10 days time. Though it's not easy, but I would say if you try hard, if you try in a structured way, if you try in a method that we normally like practice, and over years of our like training as well as teaching people, we have done something which would be definitely helping you to crack the exam in 3 months time. So let's start with one of the quote. I got it from somewhere. I thought I would be sharing with you all from the very beginning. Which is more important? You can see one panda and one tiny dragon. Both are like walking. And the panda asked, which is more important, the journey or the destination? So if I expect answers from all of you, anybody? Journeying a destination, we all know the quotes related to journeying a destination. But the answer which I got from this quote, why I am saying that, it's the company, said the tiny dragon. And that's why we are here. As 360 Critical Care, as TRICS 1, or you can name anything, we are here to help you as a team and as you can say mentors, or you can say as friends. Now, there are certain well-proven points related to critical care and related to the critical care examinations. We all know this is an evolving branch, more specifically after the COVID time. Critical care has, you can say, risen to a top level or top-notch super specialty, more specifically after COVID time. Everybody would agree with me. Yes, to crack any of the critical care examination, as it is a multi-specialty, you can say class, or you can say the training or clinical curriculum. So definitely it needs more focus, strategy and practice rather than a simple, you can say, or a like a directed domain or specialty. Now, if we'll take example of the EDIC examinations, they are more comprehensive nowadays. 10 years before, it was not that comprehensive, but yes, gradually the EDIC examinations are getting more comprehensive, and you need to have proper plan or strategy to pass the exam. I would say to appear exam also, you need to have proper plan, because getting a seat now in EDIC 1 or EDIC 2 is a nightmare. Now I am getting so many calls just before 1 day or 2 day before opening of the registration. Now the registration for part 2 is 20th of June. Now I am getting so many SMS or WhatsApp message just to help them how to crack a seat in getting the next November session EDIC part 2, not to pass, rather to get or secure a seat. So that's the, you can say, the competition right now that is happening in EDIC part 1 as well as part 2. Now, the preparation, as we all know, that needs to be guided, and it has to be started early for the success. If you are delaying, definitely you would be confused how to start, how to continue again, because we all are working. We are not sitting idle, just like what we are doing in our postgraduate final exam time. So definitely it's a little bit Herculean task for everybody to do the clinical work, to maintain or to like do the family concerns, and also simultaneously to read and prepare as well as pass the examination, which is so comprehensive and structured. I believe everybody will agree with me that. Now, why we need some professional coaching or training, I would say, to pass or clear the EDIC part 1. It was not before like that, but yes, in critical care, we do not have a structured course format till now, though it is slowly evolving or developing, I would say. But most of the hospitals, the training institutes, they have unplanned or I would say heterogeneous academics still persisting, more focus on the workload, and we are always like discussing about the volume of patients we are treating rather than the quality work we are actually delivering at the bedside. If we would discuss about the education or our like own efforts to learn, we do not know what to read, and I would say more specifically what not to read, because most of the time we read the things which are not at all required to be a good clinician or to pass the examination. So there are two different things. Now, less focus on academics, more focus on the clinical management, and that's more pertinent to the corporate hospitals where most of the students or trainees are right now working. Now, it's not like that our MBBS or MD days or our postgraduate days that there is a teacher, there is somebody learned, some senior, some big brother, they would be holding your hands to teach and make you smarter professionally as well as in your like the learning phase. And we do not have time also like our MBBS or MD days, so it's very difficult to like maintain the balance between your work as well as your study. We all are aging, so definitely that is also one more concern right now, along with our family matters, which is again one of the limiting factor to pay all our attention to the teaching or to the learning part. Now, we are here to help you definitely as a team, as we have already told. We are here with all the advice, help, support, tips, guidance, and assistance that we can offer. And definitely, as a team, over the years, we have gathered that experience to actually handhold to pass this type of difficult, you can say, area. So 360 critical care is all about technology, information, and we have conglomerated the technology with the right amount of knowledge, information, content to make our students, our teachers, our trainees better day by day. There are certain disclaimers right now from the very beginning. This is not an official presentation from ESICM. Whatever we are presenting here, this is based on our own experiences while preparing for the examinations, while we were the trainees, and
Tapas,
also, yes.
just want to interrupt. Sorry, your
Yeah,
voice is a bit low being told, so please come close to the mic.
okay, okay. Now it's okay.
To me, it is okay.
Yeah. Is there anybody who is facing the similar problems?
Just carry on then, please.
Okay, okay, okay. So definitely you have to prepare for your examinations based on your own understanding. But yes, we are here to help you. Now, the webinar, what we are right now doing today, it's just to help you to like better systematically approach the EDIC part 1 preparation and also the examination, because the examination part is slightly different than our Indian examinations or the country specific examinations. Now, what is an EDIC examination? If we will like start with that, this is the examination, signature examination event from the European Society of Intensive Care Medicine. And this examination set out in two parts. Part 1 is the written examination and part 2 is the oral or clinical case examination. Now we are not talking about EDIC part 2, which is again another course we will be having after a few days. But yes, let's focus on the part 1. Part 1 examination is conducted twice every year, as spring session and autumn session. And we all know EDIC is right now not only limited to Europe, rather the significance, the acceptance is spreading beyond Europe. And in India, it is one of the, you can say, accreditation for your own education as well as your own achievements. Now, definitely the ESICM or the EDIC Secretariat, they are very focused what they want from the candidates. So the whole examination or the process, they reflect clearly defined assessment goals and address necessary skills, attitude, competencies, and the knowledge required for intensive care practice. And they expect that after EDIC, these candidates should be working independently as a consultant in the respective ICUs in their own country or state or the hospitals. So this is something they don't want just as a trainee. Rather, if you are clearing this EDIC 1 and 2, you are automatically getting the accreditation, or you can be saying that the hospital will recognize you as a consultant. So that is the whole idea of the EDIC examination accreditation. Now, the EDIC acceptance, many jurisdictions, they specify EDIC as a professional qualification. In Europe, in UK, and we all know from 2015, whoever has passed or cleared the EDIC part 1 as well as part 2, so now they have a direct entry to UK. They don't have to go through the other licensing exams previously they were appearing. So EDIC is right now the licensing exam to get entry to UK, just like FRCA or PLAB before the people who were appearing. So that is one of the, you can say, that attests to its widening acceptance in Europe and UK. And for India, definitely it is one of the passport to get entry to UK system. So many of the students, after the announcement of this news, when I was the ESICM International Asia Pacific representative, so there were so many queries to start it. And during my last year, this has been approved by ESICM EDIC Secretariat, and that was the one of the achievements that we could do during my tenure. So how to start preparing for your EDIC exam? I won't go into detail because you have already, I hope, got registered for the next season, which is on September 26th, 2023. So, but those who are planning to appear the EDIC exam in the coming seasons, so definitely you have to visit the site, create your account, make your own EDIC profile, and then we all recommend that you should become the member of ESICM. Though it is a little bit of pricey affair, every year you have to renew. But yes, if you are planning for the examination, at least for 1 to 2 years, you have to be the member. In that way, you will get many of the, you can say, the bonus things that the ESICM people offer. That is the ACE modules, that events conducted by ESICM. You will get discount on the EDIC examination fee, EDIC conference, the ESICM conference registration fee, as well as the ESICM preparatory course. So these are the few, you can see, perks they normally offer if you are one of the ESICM member. Now you can get all the details in the link as well as if you visit the site. Let's go into the detail. What is the EDIC 1 syllabus? So they have a very structured syllabus based on the TRICS. So if you find that TRICS, it is clearly written. Let's focus on the EDIC 1 syllabus, because that will give you the idea where you have to focus or pay more attention to your preparation. The first part that I want to highlight here, this is all divided into a percentage basis: 20%, 15%, 10%, 5%, 15%, 10%, 15%. Just like MRCP, or I would say any other, like you can say international exam, it would be more focused to the cardiovascular, respiratory system, as well as different organ system. 15, 20, 15, 15. Now, The other system you will say here renal, genitourinary, though renal is more important, but yes, they give only 5% weightage and 10% to the hemato-oncologic, metabolic, toxic, endocrine. Here 15% and given to the two major systems, neurologic, gastrointestinal disorders. And the last 10% you would say here resuscitation, comfort, recovery, end of life care, safety, and health management system. So this is in rough, in broad way, you can say the chapters and the weightage. Why we are showing it? Because the course materials that have been developed keeping all these things in mind. So there would be domains of cardiovascular, there would be domain on the neurologic, there will be domain on the gastrointestinal, and we are focusing more on the important domains where the percentage of questions should be more. So that is the essence of this slide. Now, if you have already applied for EDIC 1 for the upcoming season and you have booked your seat for the 26th September 2023, I hope it's almost neck to neck time. So you have to pull up your socks. It's almost, you can say 3 months, though I am saying it's 10 days or 9 days, but yes, it's 3 months time. And 3 months is, I would say, little bit of, you can say, difficult time frame you have to maintain. Otherwise, slowly, gradually, you will be in stress as the days would pass. The format for part 1 exam, it's a written exam, just for the sake of understanding of many candidates who are planning to appear. 100 MCQs to be solved in 180 minutes. It's a little bit of comfortable time, I would say. But yes, the questions related to A type and K type, they have made it more of 70 and 30 now. It can go up to 75 for A and 25 or 30 for K, depending upon that particular season. But yes, more of 70 to 30. Previously, the K type questions were more, but the feedback from the candidates were like it should not be more of K time, which normally like they would take more time to solve the questions. So gradually the ESICM people, they have made more of A type questions to relatively make the pass percentage more for EDIC part 1, because A types are a little bit easier to score. And if you know the answer, you don't need to think about the other options. That is the significance of the A type questions. Now, in the A type MCQs, we all know there would be 5 choices for a STEM question, and you have to choose the best option. So that is the little bit of easier like part related to K type. Similar, or I would say contrary to this, in this part 2, the CCS and CBS, the CBS is relatively difficult than the CCS. Now, the A type questions in EDIC part 1, that would be more of testing your knowledge of like how you are more comfortable or confident or clear about the concepts, or I would say the width of knowledge has to be broad. That is the essence of the A type questions. So you are getting a full mark if your choice is right. And in the K type questions, there would be 4 choices. In the A type, it will be 5 choices. In the K type, it will be 4 choices for a STEM question, and you have to mark it true or false. So each option you have to think about whether it is true or whether it is false. If all the options are correct, what you are like marking, so if it is true, false, false, true, and the answers are also true, false, false, true, you would get a 1 mark. If 3 out of 4 options are correct, you get half mark. Less than that, you get a big 0. So that is the pattern of the K type question. And the K type questions, they are supposed to test your depth of the knowledge in the critical care. So A type is your width of the knowledge, K type is your depth of the knowledge, and you can get everything related to the pattern of scoring and the criteria for passing in the website in the link provided here. Now, how to prepare for part 1? I've already told. If you have not started yet, 3 months at least is the optimum time, because this is a pricey exam. You spend a lot of money and also your time. You should start with a basic textbook where you should clear your concepts, because last 1 month, 2 months or 3 months or joining our course, you need to have your concepts clear before that. Otherwise, it would be all MCQ based preparation, or normally they say it is a retrospective. So you read the question, you clear your like the answers, and then you read the text related to that question. So that is the format which is proven all over the world during the last 2 to 3 months when you join any of the courses. Now, reading the pact or the S modules, pact was previously available with the SICM website, but now it is all S modules. It is needed because it is a European exam. So definitely everybody expect that you should at least go through some of the important domains from the S modules. But whatever resources you are using or studying, you should clear your concepts related to that specific domain. Otherwise, it's not so easy. They will change the questions. They would not repeat the questions, or it's not like not taken from any MCQ books. Now, you have to be updated with the webinars or the information normally they provide during their scientific events. Just like 2 days before, the SICM has released their recent ARDS literature guideline. So that you have to read. So if your exam is 10 days after from now, definitely most probably they would like put a question related to that ARDS guideline. Now, also you need to be very thorough or clear your concepts related to some of the landmark trials or some of the game changing trials or publications that have come up in last 2 3 years or maybe 5 years. Whatever the question should come, the SICM people, they believe that it has to be evidence based, and you should be thorough about the recent advances, because it's something they normally expect that the candidates should know and practice in also their own clinical areas. What we prefer or we advise, you should start making your small notes, whether it is handwritten if you are comfortable in that, or if you are a techno savvy or you are a gadget freak. So definitely you should use your iPad or tabs in a better way for your exam preparation. And that's the reason why we come up with the app, because many students, they suggested or they have given the feedback that attending with a browser or in a laptop is not very convenient in their busy schedule. So that's the reason why we come up with a mobile or iPad based approach. Now, how to prepare for EDIC-1? Dr. Sananta would be making your task relatively easier. I would be more focused with the module based or domain based preparation. You take one domain, cardiology, keep 15 days or 10 days, start with the questions, read the text related to that question, where you are actually weak in that domain, clear your concept in those 10 days or 7 days. And that's the concept with which we have come up with weak based domains. And that's the most important feedback that we have got in last 1.5 years for our EDIC part 1 as well as EDIC part 2, because we normally release the domain in a week based. Like if it is first week, we provide the questions on day 1 of that week, cardiology, and the candidate gets 7 days time to go through all the materials, the articles, the quiz, the image, the clinical scenarios, the MCQs, and in that time they would read the question related text and clear their concept. And also we advise that you should attempt like appear some of the mock test, and that's the reason why we have 3 you can say very important and also you can say scientifically designed mock test before the final exam. So if it is September 26, definitely we will be having the 3 mock test from September 1st week, so that by September 26 you have at least 3 mock tests that would give you a confidence boost that yes, I have scored almost 75%, 80% in the mock test in this academic course. So maybe I would be also scoring around 70% in the final exam or the rehearsal before the exam. And also the course will be helping you to know your weak areas that would you can strengthen before your final exams. Now, there are certain books I would not take much time. We all know the textbooks. That is right now, I would not advise to go through the textbooks from page number 1, But yes, whenever you have doubt, you have to clear your concept. Maybe you can take help from this type of textbooks, but these are definitely very lengthy, voluminous books. This is the newest addition to our critical care textbook armamentarium, the 8th edition of John Louis Vincent textbook of critical care. There are multiple MCQ books which are available in the market online, and I think everybody's laptop, iPad or mobile is having these books already. So I'm not going into detail. You will get questions and their answers related to these important domains that you can go through. We definitely advise 1 or 2 textbooks you can choose and start doing the MCQs. There are multiple. I would say the market is flooded with MCQ books, and we would not recommend any specific book, but yes, 1 or 2 books where you are more comfortable with. There are multiple internet resources that will be very useful, and we strongly suggest better to use these internet resources because they are more authentic and people have already used it for last couple of years, and they get changed, or you can say updated, every 1 month or 2 month basis. And few of these are very important: Life in the First Lane, MCRIT, Deranged Physiology, Up to Date, ICU one pager. So that would give you the concept, or like the 1 page analysis of a very important clinical case or scenario. Last but not the least, we are with you as a team, as a guide, and we would definitely help you. And without wasting further time, I would take this opportunity to welcome our young dynamic intensivist and teachers with us today. Dr. Sananta Kumar Das, he is the course co-director with me, and he would be taking the next lecture. So he would be introducing him in a better way. Very enthusiastic and teacher par excellence, I would say. Dr. Priyank, who is, I would say, very enthusiastic academician. He has contributed in a big way in the cardiac critical care. And along with him, Dr. Sananta has taken the pain in framing all the questions related to that domain. So I would like give the opportunity and give the time to all of the faculties to share their own experience as well as their like the questions, how they have prepared at the end. But yes, I would be inviting them to our forum for today. Dr. Manjunath, he comes from Bangalore, and I hope everybody knows him. He has many feathers to his cap. He has contributed to the gastroenterology and hepatology. Dr. Manjunath, are you here?
Yes, I'm here.
Yeah, Dr. Manjunath, hello. Yeah.
Mm.
So at the end, they would be sharing their experiences as well as their suggestion to all the candidates. I'm just going through the faculty's names and inviting them to our forum officially. Now comes one of the very gentleman and young intensivist from Bangalore again, Dr. Jitendra. And believe me, he is a silent killer. He prepares the questions, he teaches in a very different way. And he has taken the pain in preparing the questions related to one of the important domain, that is the respiratory. And the questions were fantabulous, I would say. Yeah. Now, next comes from another continent, Dr. Sarang Naresh Khirsagar. Because of the time limits and you can say the differences, he is currently in Toronto and he's doing the fellowship in University of Health Network St. Michael's Hospital, where my training is from. So he has contributed to the things related to brain, that is the neurocritical care, and he has apologized not to be part of the today's discussion because it's early morning in Toronto and he's in hospital. Then comes Dr. Dona Saha. So she is again one of the you can say the young person, young intensivist from Bhubaneswar, currently working in KIMS Bhubaneswar. She has contributed to neuro monitoring. She is DM in neuroanesthesia and critical care, and within 1 month she is traveling to UK to pursue her further fellowship. So that would be Dr. Dona. Dr. Rajesh Kasi Mohanty, again related to my alma mater, St. Michael's Hospital, Toronto. So from Vizag, Apollo Hospital, Vizag, and he has contributed to the part which is the bread and butter of critical care, that is sepsis. and infectious disease. So he would be sharing his own suggestions with all of you. Then comes Dr. Mona Lisa Mishra. She has contributed to many of our courses before also. Very, you can say, avid academician, and having clear interest and expertise in the nephrocritical care, and she has contributed to the nephrocritical care part. Welcome, Dr. Mona Lisa. Are you here? Okay. Now, then comes Dr. P. Praveen Kumar. You can say I have requested him to share his experiences as well as his expertise towards the end, and he has candidly accepted my invitation, and he is preparing for one of the important domain, that is the taking care of the critical ill organ support of one of the modules as per the Covatrice. Dr. Santanu Bakchi, my dear friend from Kolkata. So he has contributed again to one of the important domains related to obstetrics, then organ support, toxicology, and finally, I have also contributed to the transplant, then the poisoning, then the oncocritical care. So with this, all these faculties, we would be sharing our like suggestion to you at the end. But before that, I would request Dr. Sananta to please continue with the newest form of education in India, that is the 360 Critical Care app, and also TRICS 1 course. Any questions, I would be happy to take. Yeah.
Thank you, Tapas, for your elaborate discussion. I'll be very quick, just going through the main important points of our plans that we have in place. So as Tapas was saying, this is a preparatory course for EDIC 1. I work as a full-time consultant in intensive care in Australia, in a place called Townsville. Also, I work as a senior lecturer at the GSU School of Medicine and Dentistry. I am the research lead of my hospital and ICU where I practice. Now, just the summary of the whole course in one page. EDIC 1 has got bigger and bigger over the years when I passed, or when Tapas and I passed, to the current scenario. That exam has transformed a lot, and they are more and more comprehensive, as the word Tapas was using. I agree with it. To pass the exam, we need an organized structure, and it has to be targeted. You cannot read through the whole syllabus from 5 books. It's not possible. So you need to know where to read from and what to read. And especially you need some mentoring. Some people who have done this exam in the past are the best people to guide you to what to read, and more importantly, to what not to read. Few disclaimer, as Tapas has gone through, stands the same for me. We do both preparatory course for EDIC 1 and EDIC 2 twice a year. We are no way related to ESICM, but we respectfully admire that institution, and we provide an educational platform to help candidate to prepare their exam and pass their exam. So the course as such is combination of some pre-reading material that is shared or will be shared to all the enrolled candidate. We have divided them into 10 modules, which corresponds to the same module provided by the EDIC 1. And there are 8 to 8 modules as per the EDIC 1, and there are 2 additional modules to cover some peripheral subjects. The candidates will have access to the modules at the beginning of enrollment. They can read, they can study from that. But no way it substitute the use of the PACT or the ACE module. You need to go through those modules also, because they are from ESICM and they are very helpful in the exam. Each module has a embedded mock test that you can appear on your time through your device, through your mobile. That will have some K and some A type questions. Those questions are very important. They may not be the question that are going to appear in the EDIC exam, but the explanation to that question covers the associated question around it. For example, if you talk about IABP, there will be a question or a graph of IABP as a MCQ or A type or a K type. That same question may not come in the exam, but the explanation given to that question, which is readily available in your device that you can study or read, is important because it will discuss about most of the important questions associated with IABP. Suppose whether it is literature, what are the type of waveforms, what are the contraindication, what are the indication of IABP, all those things will be covered in the explanation and will be highlighted as possible questions. So that's where this course is important. We do provide you MCQs, but no way that is the only thing we provide. We provide a more broader aspect to the preparation. You can look at specific domain and the questions that can be asked, we discuss in the explanation. I'll go through a little bit in detail after that. We will have intermittent Zoom session just as a collaborative session, how you are going to check what are the things we are lacking, what else we can help you with. On the right side, as you can see the modules that is according to the EDIC syllabus, cardiovascular, central nervous system, GI, and the percentage that we have. We have focused our attention based on the classification given by the EDIC or ESICM. That's what is the basis of the course. We've divided the chapters accordingly and the modules are fit accordingly. The reading material are fit accordingly and the mock tests are also fit accordingly. If you look at the previous year questions, these are the feedback from the memory-based questions from the candidates that appeared the last EDIC exam. I have divided what are the exam questions and tried to see whether we have covered most of them or not. For example, in our module 1, there was cardiology. There were questions on ECG, which were our module will talk about different type of ECG, how you distinguish a pattern in the ECG. There was a question on adenosine. There are a few other questions on hemodynamic monitoring, others. So most of it was covered. Similarly, module 2 questions, there were some cases that were asked and most of that were covered also in the module in terms of question that was given in the practice mock or the reading material provided in the practice mock. So as EDIC syllabus goes, whatever they have divided, the questions come from those modules only, and hardly you will get something like a bouncer that you don't know what is it. So it's important to structure your preparation according to the modules given by the EDIC, which we stick to also. This I have talked about. So the enrollment has started already. There is a link how to register on the app, or you can go to our website and there is a link you can directly register through by payment. The fees have been reduced this time from last year because this is all app based and we want to cover as many candidates as possible. If that's the aim, because we target a very broad population, we don't charge them more because that will be the ultimate aim to make the course more feasible, more affordable to everyone. So we have reduced the course by 1/3 of its cost from last year because we expect more candidates to enroll and that can take care of the cost of running the course. So that's why the course fee has been reduced. And in that sense, I can say this is the most affordable course to prepare for EDIC 1. Now going into our initiative, the new app, just few slides. So it looks like that. And it is only one stop for all the critical care specialty exams, starting from EDIC 1, EDIC 2, and other DMN, DRNB exam. All the materials and everything will be sectioned there, and people enrolling into specific course can take the advantage of the app. currently, as our society, we or our endeavor, we run multiple courses. Suppose was talking about TRICS 1, which is EDIC 1 preparation. EDIC 2 preparation is called as a TRICS 2. We do run on-site preparatory course for DM and DRNB each year, multiple sessions, and we run an online preparatory course for DRNB specialty and DM specialty exam. That is a 4 month plus long course for comprehensive review of the whole syllabus. We do have other priorities and other courses that we run. This is not the platform we will be discussing, but the point of this slide is we are a education institute that has a multifaceted look to it, starting from European diploma preparation to any other specialty preparation and subspecialty courses also, like a critical care review course that we conduct multiple times in the year. For our app, so it is readily available on the Google Play and also in the App Store. And we have sent multiple flyers to how to download that and how to run the app in our system. There is self-explanatory videos attached to our websites, and also it's readily available. You can search through the App Store and the Google Play, and the app is free of cost. You can download it. There is a advantage that you can enroll into a mock test, which is just like a EDIC pattern but less number of questions. We have 20 questions in there, A type and K type, and you can self-evaluate yourself to give a try how the app runs, how the exam runs, and how you can look at the solution for each question, what the solution contains, and how extensive is the reading material that is being provided with each question. So I would encourage, if you haven't tried our app and our free mock test, please go download the app, appear the mock test. You will see where you stand also. What is the difficulty level of questions that you get? How do you answer the question? How the exam grid or the answer grid is set in the exam, and all those things are explained there. This is a short preview of the mock of the app. How does it look? That's the main page on the left side, or your left side. There's the main page where you see that this is a free mock test for EDIC 1. After downloading the app, you can go there and you just click here. You go to the next page, go there. It says one test learning material. This is a free test. Again, it lands up into this page, and that's where you attempt the exam. It is a multiple attempt exam. You can appear hundreds of times of this free test and see how the marking is done. What is your weak point? What is your strong point in that? As I said, that's our module structure for the whole course. We have added 2 new modules, module 9 and module 10. Module 9 is done by, I think, Dr. Dona, and module 10 is done by me and Tapas, which is the most interesting, is the miscellaneous domain that will come up gradually. So how the course run is, first week you will get all the study materials for all the modules, but not the mock questions, right? The first week will open with the cardiovascular mock questions. You will appear the questions whenever you have time, and you see how much you have scored. You can have the solution. The next week, the neurological disorder module will open, and you appear the exam on that next week. This is because we don't want to give access to all the module at the same time, because we want you to complete one module at a time. The study material that is provided in each module needs to be gone through in detail, and also the ACE module. So that's the homework for the week. You read the whole module or study the whole module and appear the exam. Not like, oh no, I'll give a try. Yes, you can give a try, but it doesn't count, right? You need to be prepared with your study and then appear the mock exam. So that's why each week we open one mock, and that will run for 10 weeks, and then you'll have 3 more whole syllabus mock. So the last 3 mock tests will include the whole of the syllabus. This is the whole syllabus of the EDIC 1. All right. Then, as I said, sorry, each module, um, at the beginning of the enrollment, you can access the whole study material, but not the mock test. Mock test opens in each week. MCQs are as practice mock in each module are both A and K type. Questions will aim to cover the whole content of the syllabus. Each question will be provided with an extensive explanation to tackle any further variation or associated question in that topic, right? For example, this one is talking about a 35-year. This is how the app looks like when you enter into the free test. This time you can see neuro. This is a type A neuro question. Then the next question is type K neurotype. Next question is the respiratory system type A, respiratory system type K, cardio type A, renal type A, renal K, and henceforth. Like every question that will tell you which type of question is it, and then it will give you a time frame how much you have taken to solve the question. Then you read the question. This is a 35-year-old female suffered a head-on crash with traveling at a speed of 100 km/h. She required to be extricated from the vehicle and was intubated on the scene with pre-intubation GCS of E1, V2, M2. On arrival in the emergency department, blood pressure was low, heart rate was a bit high. Neuroexamination revealed an unequal pupil, 4 and 6. Her left pupil is non-reactive. The most important next step to improve chances of survival is what you do. A, B, C, D. This is the question. Sorry, can I request everyone to just mute the Zoom, please? Thank you. So that's the question. You take time, select the choice. The answer comes is at the end of the question round. You'll get the answer. So that's the possible answer, and then you go for the explanation. The explanation will be talking about everything. Osmotherapy, how is it helpful? It will give you a suggested answer, right? And it will also tell you how important is this question. So you need to study or give more focus on this, go through this reference, get a more detail of this explanation. So the explanation is pretty extensive, actually, not in this question, but other questions will have a lot of explanation and highlight what are the possible questions that can be asked on the same topic. Then at the end of the exam, if you have 50 mock questions, your what do you call, the performance page will look like this, right? This is the free test, which has 20 questions. So it says total number of questions are 20. Then how it is marked, the highest mark secured, the average mark secured in this exam, who has topped the list, who is the second, who is the third, who is the 10th, who is the 15th, like that. And then analysis of the question, what you have done. So neuro A type, what you have done, what the topper has done, what's the average answer was. Similarly, neuro K type, what you have done, what the topper has done, and what is the average performance on that score. And the type of question, that is how many are hard, how many are medium, and how many are easy. In that, it will show you whether you are doing good in the medium hard question, or you are doing good in the hardest question, or you are doing good in the easiest question. Just a breakdown of the whole performance of your mock exam. A few of the information are very useful in that, right? So that's about a little bit of the mock exam or the app, how it will look. We've already launched the app already. This flyer is floating around. This is same flyer also there in our website, 360criticalcare.com. You click the registration link and you will get registered to the course, or at least you can go and register into the app and at least look at the free mock test, how the mock test runs, and if you like, you can enroll into the course after that. So the mock exam, the free mock exam is free, so you can always go and appear that exam. That's probably the last slide I had. Any other questions, you guys, or any other explanation you need? I'm happy to answer, or Tapas will be happy to answer. Back to you, Tapas.
Thank you, Sananta, for explaining the whole process. And along with these domains, we are also having 3 mock tests at the end of finishing all those 8 modules or the domains. So as I have already told before in my presentation, that will be the final dress rehearsal before the EDIC 1 in the September 26. So that will be conducted again in the month of September 1st to 2nd week. So it's everything is at right now at your fingertips, and most of the advanced you can say examinations, they normally right now rely upon this type of app based training, where you will get almost 600 to 700 questions related to EDIC 1 in one go, and every time this would be updated and the new questions will be added during the 3 months of time, and also many flowcharts, quizzes, images would be added to the app, so that you can get all these quiz of the week, the question of the week, some of the clinical snippet we want to share with you, so that you will clear your concepts. That will be again the additional things that will be added every week basis. So with this, I would now request all of our faculties to share their own way of making the questions and how they expect that the examiners should prepare. So I would start with Dr. Manjunath. Dr. Manjunath, could you please share your suggestions and tips for the candidates?
Hello. Thank you, Tapas and Sananta, for this app-based on the learning now. And the last year, so we were all undertaking in the live session. So now it is like more of app-based. So which is, I think it is for this generation, I think it is actually better. So because people will be busy in their own work, in their shifts, and it will be difficult and for them to attend all the sessions like with us. So see, coming to the exam preparation, I think, and the Tapas and Sananta has covered extensively about all the books and all that. So my sincere request, like for you guys, is if you're giving exam, and you should have the dedication and the commitment for the next under 2.5 to 3 months, like for the exam. So, and you should have a target, and at least in a day, I'm going to do around under 30 to under 50 MCQs of any topic. Okay, so my request for all of you is, first you should get accustomed to the MCQs, in the sense A type and the K type. The A type needs your approach, and the K types needs in-depth and knowledge. So that matters a lot there. So because in exam, it might actually vary on the percentage of the A type and K type. Sometimes it can be 70-30, or sometimes it can be 60-40 or 80-20 as well. So you should get accustomed to these MCQs. So always try doing MCQs and every day. Don't sit and read the theory. First do MCQs and see like where exactly and you're going wrong in that MCQ. Means like in the specific topic, if at all, if I am dealing with on the GIT, so if at all, if I put a MCQ on GI bleed, so, and you should know all the recommendations, and also in a patient with like massive GI bleed, how I'm going to approach. So all this, like if you know the guidelines, all these MCQs are made on the basis of guidelines for everything. So, and you should be aware of guidelines and also approach, and also and the topics for this EDIC is sometimes it will be slightly different. So GI bleed, the pancreatitis, and if at all, if I have to tell some of the rarest the topics, like what we don't come across in India, in the sense in your practices, the C. diff infection, though the incidence we find in our ICUs is less, but in depth of the C. diff infection. In my exam, I had in the K type like 3 questions on the C. diff infection, Clostridium difficile infection. So, and you should know the recent the treatment plan, how it is, the guidelines, how it has changed, in the severity, how to assess and all that. So apart from the C. diff infection, many other entities which we don't see in our ICUs, it may be and very frequent in those ICUs in the Europe as well. So if I tell about the poisoning, and the paracetamol is the most common there, and you should know each and everything about the paracetamol, the poisoning, about and the chart how to do for and to see the severity, and about the disease part, and the treatment, and also about the liver transplantation criteria and all that. So the best part is be stick on to this course if at all if you're going to join here, and be disciplined and committed for 1 week. So in the sense, if at all if you have cardiovascular in the module, like make sure you have exam in 1 week and you give your best, and sit and read at least a day. You should sit for at least under 2 to 3 hours and do at least around 35 to 50 MCQs, and get accustomed to all these MCQs, and do your own notes if possible, and see our modules and ACE modules as well. I'll not take much time. So there are like a few of my juniors and my friends and also my seniors in this and the faculty group. So I'll ask them to go ahead now.
Yeah, thank you, Dr. Manjunath. So now I invite Dr. Rajesh from Apollo Hospital, Vizag.
Good evening, everyone. First of all, thanks to Dr. Tapas and Dr. Sananta for the opportunity. So, I'm not going to give any major suggestions, but what I've covered in this MCQ, like this app, was I've connected, have prepared questions for the infection part. So, my idea of writing EDIC Part 1 exam is, especially as Manjuna said, I try to cover the most common topics, or like most commonly asked questions in EDIC Part 1 around infection. Apart from that, like I try to cover all the most possible guidelines and the most commonly asked literature, like the research based questions around this infection part, and the uncommon infections what we usually don't see in India. So that was my approach in writing the MCQs for this app. And my only suggestion will be, first try to look at your whatever the cobalt rice based way of defining the percentage of questions. And once you have any, you try to identify your weak areas and strong areas in any particular system, and try to work around the weak areas, and then try to have some good understanding about theory around the topics, and then go through all the assistance given through this app. And I wish you good luck, and of course all the suggestions, especially because I've written about infection side, any suggestions are most welcome. Of course, I think we'll get back to it at the end of this 3 months preparation. That's it from my side.
Thank you, Dr. Rajesh. Now I would move to Dr. Dona. Dr. Dona has contributed in the neuromonitoring part.
Hello, good evening, sir. Am I audible?
Yeah.
I'm so sorry because some technical glitch I couldn't be able to be visible, but I can be audible. Thank you, Dr. Tapas and Dr. Sananta, for this wonderful opportunity. It's a kind of a joyful ride for me. And I have contributed to the neuromonitoring part, which has already said as the Dr. Tapas that it's a new part. It's recently added to the new EDIC 1 session. So as we all know that critically ill patients can frequently have a risk of neurological dysfunction, and that may be a primary neurological insult, and at the same time, it may be a secondary insult also. So we need to actually specify, but brain actually contributes a huge to our body. It consumes 25% of the total energy. So we need to actually specify which part of the brain is getting affected. So determining which aspect of the brain function is getting affected, and that's where comes the use of neuromonitoring. As we know that clinical neuromonitoring is one of the best tools what we are using, and it's a fundamental component of neuromonitoring. But I think all will agree with me that the clinical neuromonitoring may be confounded by many factors, like if the patient is sedated, paralyzed, and anything. So in that cases, we need to take help of other armamentariums that we have. It may be the intracranial pressure monitoring, it can be the brain tissue oxygen saturation monitoring, both invasively and non-invasively. It can be electrophysiological monitoring, like a continuous EEG to pick up any seizure activity or unknown non-compulsive seizure activities, which is very, very important and most of the time goes unnoticed, especially in a comatose patient. And others are, it may be cerebral metabolic management like microdialysis, which can give us very valuable pathophysiological events that is going on into our brain. So there is various armamentarium that I have covered in my topics, in my questions, and I wish the explanation that I have provided will help all of the candidates to have in-depth knowledge and understanding of the brain function. And further, the links and the references I have put will help them to generalize, all go into much depth of the knowledge and ultimately come into a comprehensive understanding how brain is getting monitored. So with all of the helps and tricks from Dr. Tapas and Dr. Sananta, I wish all of the students very, very best for the upcoming Ethic 1 examination. And any of the criticism is well accepted. And thank you so much.
Thank you, Donna. She has contributed, I think, the fastest one to complete the assignment, and also she has done it in a very, you can say, unique way. Yeah, thank you, Dr. Donna. So now I move to Dr. Priyank. Again, he has contributed to the cardiac critical care part related to the cardiac ischemia, the enzymes, the IABP, the advanced monitoring part. Dr. Priyank. Yeah. Dr. Priyank? Yeah. Are you there, Dr. Priyank? Okay. So in the meantime, I would move to Dr. Santanu Bagchi from Kolkata. So he has contributed to, again, one of the, you can say, atypical domain related to, you can say, end of life care, the health management system, then palliative care, and toxicology, as well as obstetric critical care.
Yeah, good evening, Mike. Good evening, everyone. Thank you for the opportunity. Definitely, it's it is the biggest preparatory course, not only in this part of the country, rather this part of the world. It has become quite well known across outside India also. People from UAE, Egypt, Bangladesh, and many other areas, Nepal, Europe. Last year we had people from Portugal also. Doctor have joined. So a lot of people are joining only because of the quality of the content, I would say. And regarding the part, my part, see, this is a varied topic, but there are some areas which you need to focus on. Like for an organ support, you already can understand any kind of shock will be very important. Trauma, cardiac output monitoring, resuscitation, deresuscitation, that concept, massive blood transfusion, extracorporeal support systems or CRRT. They are very fond of asking about CRRTs. The CRT prescription, what will be the maintenance fluid value, and all those things are pretty common to ask. Then electrolyte imbalance, they are very fond of asking about anion gaps, anion gap metabolic acidosis. How do you calculate, and what are the values, what are the causes? That is also a very common question. Gap analysis, those things will be interesting. Then in the post-operative part, they are quite fond of post-operative respiratory failure, as well as post-operative analgesia. That part is also important from the exam point of view. Then regarding palliative care, the more important thing is the ethical issues. They keep on asking many questions, like patient is not willing, patient doesn't give in consent, what you will go ahead. So those end of life care combining with ethical issues, that is one of the very pertinent area from where definitely we'll get one or two questions. There is no confusion in that side. Then organ donation, there now, although we have separate domain for transplant, but still organ donation, preservation of the organ, what are the criteria, what are the monitoring you need to do. So brain death and organ donation, again another very, very, very important topic from where you are supposed to get some question. CRT, those though again renal system is there, but still CRT, that circuit diagram, that also they give sometimes questions on that also. See, nowadays you will be getting a longer stem, so longer stem will always be difficult to read, but you usually remember the questions will be very practical. So try to answer very logically. You may not be knowing the theory, but you might be practicing it. If your practice is standard, you might be able to answer. And definitely our modules will be very, very to the point. So if you're going through the modules before appearing for the exam, So it will be very helpful for you to go for the mock test, and subsequently in the final exam, it will be easier for you to appear and crack the exam. I guess with this, I would like to conclude. Thank you for the opportunity to everyone, Dr. Sanand, Dr. Tapas, and definitely great. And I'm really humbled to be part of this journey. Thank you.
Thank you, Dr. Santanu. So you have done really hard work in preparing questions related to this atypical domain. And Dr. Priyank is here. He was having some problem in the audio system. Dr. Priyank, please.
Good evening, sir. I hope I'm audible now.
Yeah.
Okay. Thank you for making me a part of this, Dr. Santanu and Dr. Sananta and Dr. Tapas. And I've been really looking forward to joining a place like this. And the one talk that I caught upon was Dr. Tapas from your presentation, that the journey or the destination. I really felt that that was very appropriate, that being a part of this will be a good teamwork and to help our people, whoever is joining this course. And the topics that I had actually put upon was valence and STEMI, cardiac enzymes, and the most commonly thing that I use on my daily basis, the IBP, CVP, and the PA catheters. I think those are the areas which are very basic and very difficult if you have not used it. And I hope that the explanations that I've provided with the questions are enough, and if not, I will really like to be a part of the weekly classes that we have, and we can discuss even further. I think most of the people who have spoken before me have covered everything which is required to go ahead and prepare. So my take on is just keep your notes and do the MCQs as much as you can. Thank you so much.
Thank you, Dr. Priyank. He has done wonderful in preparing those cardiac critical care. Yeah. So Dr. Praveen, Dr. Jitendra, they are busy in their hospital work. So they expressed their apologies that they are unable to join. And there are many candidates, delegates for this session. They could not attend because of their hospital work or they are traveling, commuting. But yes, don't worry. We would be sharing this YouTube session, the recorded version in YouTube as well as in the app, in the website. So you would get everything what our faculties, our like delegates, they have shared their opinion. So now this session is open for like the delegates. If they have any query, they can ask any of us to clarify the doubts before we conclude. And now the session is open for everyone. So if anybody wants to add anything before we conclude, because everything has been dealt with very diligently, and I don't have anything more to add. Rather, I would say it's time to act now. And each day is right now more important, because I have already told the clock is ticking. So 3 months, it's now or never. As one of the Dr. what is her name? So she told that this is her last chance. And I would really appreciate that in a public forum, you have said that you have been unsuccessful for 2 times. That is hats off to you. But yes, I would say that we would take special care of you, that this time you would be clearing it with flying colors for sure. Yeah. So if there are no more questions, Dr. Sanant, anything you want to add before we conclude?
No, Tapas, I'm very thankful to the team, the very young and enthusiastic team of doctors who have made these questions. And what I would be looking at is talking among ourselves how to make it a bit more robust in our content of the course. We will keep on modifying and improving it for sure. So their contribution is highly appreciated. I think we have touched most of the things, and we'll see how things go from here. Yeah, that's it from my side.
Thank you. We'll be in touch. And there are many new things coming up, though not in, I would say, only in EDIC, but many new things coming up in varied areas of critical care and as a whole medical education. So stay tuned, and thank you all of you. Have a great weekend, and hope to meet you also personally, as well as do good work in collaboration with you all. Yeah, thank you.